this video, I speak to Dr. Damian Wilde, a clinical psychologist based in the UK with over 15 years' experience in NHS or National Health Service and in private practice. He also has experience as a primary school teacher. Whether you're struggling with mental health challenges or seeking personal growth, he helps you with your journey. Please enjoy the video.
Oh, hi, Dr. Wilde. Thank you so much for being here with me on Two Healing Minds.
My pleasure.
And I know as a clinical psychologist, you practice psychotherapy. And for viewers, can you explain what psychotherapy is, how it works, and how it's different from someone like, talking about their problems with a friend or a loved one? And also, what kind of topics or issues do you focus on with your, not patient, with your client to help them with healing?
Yeah, interesting topic, and obviously it's a passion of mine. It's one of the favorite parts of my job as a clinical psychologist to provide, in particular, one-to-one psychotherapy. So I'll say a little bit about the process and what it may look like in practice. So psychotherapy, in terms of how I practice, is usually a one-to-one individual space. Now, within this, the therapeutic framework is important. And what I mean by that is people usually come on the same day, at the same time, same building, same room, even down to the detail as having the same chairs, right? And what that provides is consistency, because outside of the therapy room, their life may be a little chaotic or inconsistent and feel a little unsafe. So as a clinical psychologist providing psychotherapy, I need to ensure that the space feels consistent, okay? And in terms of what the space usually looks like, people come to psychotherapy for all kinds of different reasons. Sometimes people have this assumption that people only come to psychotherapy if they're acutely struggling with their mental health. That's not always the case. Sometimes people, have it as part of their self-care. They go to yoga once a week, they go swimming once a week, and actually come into a psychotherapy space where they can bring their stuff, they can bring their feelings, and they can explore it in a non-judgmental, safe space. It can be a really important aspect of keeping their psychological health at a good level. And I think you touched upon there about how is it different from speaking with a family member or a friend. Those sources and avenues of support can be really important, and often people will recover more quickly if they do have good support systems in place. But it's very different from being in the psychotherapy space. I mean, although speaking with family and friends can be helpful, sometimes they could judge. They may start talking about themselves. That talking space can get interrupted. A friend might say, "Oh, hang on a second, there's somebody at the door."
Yes.
Right? Or, "Oh, my phone's gone. Just hang on a second, I've just got to take this." When a person's in the middle of talking about something deep, right? Come to the psychotherapy room. I'm not going to say to somebody, "I've just got to get the door. I've just got to answer my phone." That space is 100% completely theirs, right?
Yes.
That is totally theirs. And they can think, right, okay, this has happened. I'm going to take it to the space with Damien today, or I feel like this and I need to put these feelings somewhere. I think essentially the psychotherapy space is a feeling space. Feelings tend to be at the center of everything. So I think in terms of, you asked as well, what might come up in the psychotherapy space, obviously it's different for everyone, but I think initially there's the understanding part, That often is the first part of therapeutic work about why they're feeling like they do. Sometimes people have gone through traumatic and difficult life events, and it's a space to process um, those, traumatic events and experiences. Often things that come up, identity is a big thing that comes up. That's often explored. Self-worth, self-esteem, and whatever a person brings to the space. Someone might come to the space and say, I want to work on this. So often, you kind of, you'll listen to a client in terms of what they want to get out of the space, because that's the main thing. If somebody comes to the space, it's ensuring that they get out of the space what they want to get out of it. And ultimately, for a lot of people, is if they're feeling stuck and the psychological health is, it's been on a dip and they're struggling, is that they want to feel better, they want to have their purpose and identity back, and to feel more settled and content in life.
Yes, so it sounds like it's more of a safe, supportive, non-judgmental space, whereas sometimes you don't receive that, possibly from a friend or a family member, because they can say, I can't relate to you, I don't understand you. They can be dismissive, they can be critical, like, why are you doing or thinking the way you're doing, or why do you have these emotions when you shouldn't have? So I think it's safe, more of a safe place for healing too.
Exactly, and I think you made some really good points. And the thing is as well, although I provide a lot of psychotherapy for personal and professional development, I started going to psychotherapy space myself, and I have done weekly for 10 years. So I know what life is like on the other side as well. And that is a space where I can take whatever I want to take. And sometimes, people will tell me things that they don't want to tell a partner, not or a family member, not because they don't respect them. It's just because it may feel like it's something really private. And I'm not personally involved in their life outside of the therapy room, right? And that's the other thing, is there's a slight separation that they come to me and they think, okay, I'm going to tell you about this, but I don't want to tell other people. So there's a
Mhm.
kind of separateness, and that brings a level of safety to it.
Yeah, absolutely. And there can be also, conflict or struggles with a particular person. So it's
Yeah,
respecting their privacy. Maybe perhaps they're trying to figure out a way on how to handle the situation too. And also, I
yeah,
know, oh
exactly.
yeah, go ahead.
No, I was going to say, you touched upon, I suppose, there can be a difficult dynamic between, with somebody outside of the therapy room, but inside the therapy room, the other big aspect is the therapeutic relationship. Having that special, warm kind of relationship is key.
Yeah, exactly. And also, I know you have mentioned a few times that you rather focus less on a patient's diagnosis, like, for example, if the diagnosis is clinical depression, and more on formulations. So, can you explain what formulations entail and how does that shape the therapy process?
Yeah, I mean, I think in the mental health field, there often is this kind of debate around diagnosis versus formulation. I wasn't trained in diagnostics, okay? Clinical psychology training in the UK is mainly around using formulation to help understand a person and their distress in their life and their feelings. Um, pers- you may get some people who value a diagnosis. I personally, I'm a critic of the use of diagnosis, because I think they tend to come from, the DSM, the Diagnostics and Statistical Manual, and they tend to really just be sort of descriptive labels, really. And so I think sometimes a diagnosis, in my experience, can halt recovery, because I think sometimes it stops exploration of the real reasons, and that's where you'll get into it deeper. with a formulation, right? And I think as well, a diagnosis can sometimes become a person's identity. So the thing with formulation is it's about developing a deep understanding of why somebody feels the way that they do, right? So it's about making links. So, for example, if a client had said to me in sessions that they never ever cry, okay, rather than say, well, this is a symptom of a disorder, right? I might say, oh, I remember a couple of sessions ago that you were talking about when you were a child, when you cried, you would get shouted at, right? So it seems to be that actually you've shut down that system because you previously got into trouble and would experience pain when you cried because you got shouted at, and that felt awful. So now you've shut that off. So it's about making links. And it's, so it's essentially, it's kind of about looking at a person's life, their story. And it can be done in a couple of ways. Often it's done verbally in session, like with the example I just gave there, right? But it can also be done in a visual diagrammatic way. So maybe if verbally it doesn't seem to be making sense to somebody, we can kind of map it out, like maybe get some flip chart paper, and it kind of, how it looks visually is like, say, boxes and arrows. Well, this happened in your life and it made you feel like this, and this led to you doing this. So people start to see the links and think, okay, that's why I struggle in relationships, or that's why I often feel anxious, because actually that traumatic event happened to me when I was younger and I didn't have a chance to process it. So now I experience a lot of anxiety, again, making a link. So I think it's about that. It's about developing. Someone comes into therapy room and it's like, why do I feel like this? And the formulation gives them the answer. It gives them the understanding, because that's a core human need, to feel understood. And if they understand what's going on for themselves more, it's less confusing and less frightening. And then they know how to move forward and do something about it, because they've got an idea and understanding about why they're feeling like they do.
Yeah, that's a good approach to use, definitely, especially for people that, as you said, they don't know what the root of their problem or their issues are. Because, of course, you have the clients that they do know, that they know, like, well, this is from A, B, and C. These were all linked, and I know that's why that's why I have this anxiety or this depression or anything else. And that approach is good, as you said, for people that need to get into deeper, which they don't understand, like to
Yeah,
connect something.
I think you're absolutely right. Sometimes people will come in and say, I've had a marriage breakdown and I felt really low and depressed. And they know. But interestingly, sometimes if clients can't figure it out, you can see in terms of when they sat with you that it makes everything feel a bit confusing, a bit like a kind of ball of wool raveled up, and we'll unravel it and make things look a little clearer. Sometimes, though, a formulation is about spotting the more nuanced, subtle factors. Because somebody could present in front of me and say, well, I had a lovely upbringing, I grew up in a nice house, I was well fed, I was well clothed. So it doesn't make sense that I'm now struggling. But when you start exploring, and then you start to, oh, right, okay, so dad was away a lot and mum was a little quite critical. And then you start to understand and make those things. So sometimes it can be a bit more subtle.
Okay, yeah, that definitely makes sense. And I know well, this seems like very normal for a lot of people, especially when they're going through like traumatic experiences, depression, anxiety. They have psychological defenses. It just seems only natural to be either experience denial, repression, guilt, and sometimes that can impact the way somebody heals. So, how do you work with these defense mechanisms during therapy? And how do you make somebody become more aware or maybe they don't realize it. Like, don't you realize you're denying this? Or don't you realize you have these repressed feelings? How do you let them understand that's what's going on with them and moving forward from that?
Well, I mean, sometimes psychological defenses can get a bad rap, but at times in a person's life, they can be really useful and
Mhm.
absolutely vital. And I'll give you an example. So, if a child has experienced some sexual abuse at a young age, right, that is so overwhelmingly devastating, while they're trying to survive in the world and get up and go to school and to eat and to try to function as a human being
Mhm.
is difficult enough as it is, because there's that dynamic of not being old enough to look after themselves properly. They're trying, their brain is still growing. There's so much going on that such a traumatic experience may be emotionally far too overwhelming to sit with, right? So it gets repressed, right?
Yes. Yes.
It gets put away, and that enables them to survive. So they're in survival mode,
Mhm.
right? And then maybe they get to adulthood and the memories come out of the unconscious and it hits them, right? And then they're struggling. So then they may seek out a psychotherapy space. And you can understand why psychological defenses were used, because if they didn't, they might have collapsed and not got back up,
Yes.
right? So they've somehow got through. So they're there for a reason, but in the long term, they can then start to become detrimental,
Mhm.
right? And start to become unhealthy, because it can stop a person from moving forward and living their life in a fuller sense. Okay. So you're absolutely right in saying that, defenses do come up and should come up in a good quality psychotherapy space. You'll get some psychological interventions which might only deal with the kind of here and now and be a bit manualized and prescriptive in a sense, but an exploratory space will gently and safely explore defenses. And I think in terms of how they come up, when a person's in a psychotherapy space, they tend to be a bit less guarded, because outside the therapy room, they might be, the worker, the parent, the husband, the wife, the friend, and that maybe they wear a mask and keep going as best as they can. So when they get to the psychotherapy room and the door closes and they're in that non-judgmental safe space, their guards come down a bit. And if I notice some psychological defenses at play, I'll judge when it feels safe enough to start to explore and talk about them. And then together, we'll look at gently lowering them.
Yeah, so basically, as you said, it's almost like a protective mechanism at first, where it's necessary for survival. But
Yeah,
down the line, when you're past that survival stage, it can be detrimental. So you have to work through it in order to keep moving forward in life.
exactly. I think that's sort of well succinctly put. Yeah.
Okay. And also, I know that you use different therapeutic models, such as psychodynamic and integrative. And so, how do you use these approaches in therapies? And how do you choose, like, which therapeutic model to use for someone?
Okay. So I primarily use a psychodynamic approach, and it sort of originates. People may be familiar with this analyst, Freud. Okay,
Mhm.
and about that idea of having, a talking therapy space which is analytical in nature. Okay, so in a psychodynamic space, they tend to use something which is called free association, right? And that is, there's no agenda at the start of session like you can do with certain psychological therapies, right?
Mhm.
So what it's this free exploratory space, right? But what needs to come up tends to come up anyway, in my experience. It's very interesting. Sometimes at the end of the session, a client might say, "I didn't know we were going to think about that today, but that was really useful. And my job is to be really attuned in the space. And I might pick up on something, comment, and then we go down a certain. So a psychodynamic space can be sort of very exploratory. Well, also, and we were just talking about it just then, it's about focusing on psychological defenses. That's a big part of psychodynamic psychotherapy. And also, it's about, we were talking before about how people are less guarded in the therapy room if it feels safe enough. Then there might be certain memories. We touched upon this before, for example, like traumatic memories, for example, from childhood. Is maybe memories from the unconscious start to surface in the therapy room. So we look to really sort of bring out any kind of repressed unconscious memories, which might be troubling people, because although certain memories might be unconscious, they could be knocking away and affecting a person's life. So I think those are some of the kind of key aspects. And like I said before, the therapeutic relationship is key. In terms of integrative therapy, that is where, I mean, as a clinical psychologist, we've had training in a number of different therapeutic models, is where we're not model specific and we can draw upon different therapeutic models to tailor it to the individual needs of the client. So, for example, if you're in this space and a client is talking about for example, they ruminated a lot, and as we're kind of exploring and thinking about what's going on for them, I might say, well, some mindfulness meditation could be helpful. So if you model specific, you might be able to bring other things back, so we can bring aspects of this in. If a person's heavily self-critical, we could bring in elements of compassion-focused therapy, which is really good for shame and self-criticism. So really, it's where you can just bring in what is needed. You can tailor it to the individual needs. And as given the specialist training we've had, we know when we can draw upon different kind of theories and models which fit with the person's experience and might help them to move to a better place. So I think in terms of, you said as well, how would a person choose? I think it depends on their presenting difficulty. If a person just had some mild stress, maybe, some basic CBT could be sufficient. If there was lots of heavy shame and guilt, compassion focused therapy could be useful for that type of therapeutic model. And, if a person's experienced trauma, psychodynamic psychotherapy can be useful, or trauma-informed psychotherapy. That tends to be kind of a mainstream therapeutic model now. So it depends on what the person's experienced and what feels the right fit for them.
Okay, yeah, that's good. It's just a matter of being flexible, as you said, depending on who the person is, who the client is, and what they're going through. And something interesting to share with listeners that would be great is if you can share a couple of impactful self-care practices, because people experience overwhelming emotions, when they're recovering from severe depression, trauma, anything, those big emotions show up. And eventually you have to learn practices to handle them independently. If you can give listeners just two, let's see, how about two?
Yeah,
Two practices.
I think just to share a few, I think initially with trusted others, it can be useful to get perspective from other people. If you feel stuck, you feel lost, or there's maybe something that's troubling you and causing you anxiety, and you kind of don't see way out of it. If you've got maybe a family member or a friend who you think they're empathic, they show a good level of understanding, is seeking out and saying, I've got this going on and I'm feeling like this. What do you think? And sometimes gaining a different perspective can help calm kind of difficult feelings. So I think that can be one useful thing. I think other useful aspects, it's good to have, you know, if you've been able to build up some good self-care aspects, things which are going to be grounding. And what I mean by that is things which are going to help you to feel more psychologically grounded rather than feeling totally kind of overwhelmed. And
Charged.
different people, yeah, yeah,
I call it
exactly, yeah.
charge, right?
The way you kind of feel like you're just not quite present on the ground. And
Uh-huh.
I think different people have different things that they can access. But I think little things like, taking a shower slowly, engaging the senses, use of shower gel, body lotion, really nice self care. Eating foods that are going to be nourishing and mentally pleasurable. Again, engaging your senses with smelling, all the good self-care and grounding techniques, going for nature walks. And we know that nature has great benefits for mental health, and you get a sense of safety and freedom in those spaces. And I think I was just talking about safety in spaces there, inside your house and outside your house, creating safe spaces for yourself. So there could be a little part of the house which feels comfortable and safe and grounding and containing. And there could be a space outside of the house. It could be near the beach or in a nature space, and just tending to your own needs and valuing yourself and putting into place whatever is best for you, and not falling into the trap of being agreeable, and instead being assertive and thinking about and putting into place things that meet your needs and not trying to please other people all the time.
Yes, yeah, definitely. As you said, being attuned to what you need at the moment and, setting the boundaries, removing yourself, finding that safe, quiet, whether it's a work day, you're at home, you're out, in any place, and a little escape plan just to kind of get yourself grounded. So
Yeah,
yeah,
and
that makes,
you mentioned a good. Often a lot of what we do in sort of therapy work, or people may do it themselves outside of therapy, is becoming what I call self-attuned, and that is knowing what you need and when, and putting it into place. So if sometimes your brain might say, "I need a nature walk," or I need to see my friends," or "I need a bath," or "I need to take 2 days off," and because with physical health, if you cut yourself, you'll go and wash your cut and get some Savlon or a Band-Aid or whatever. You need to do that with your psychological health. When you notice something, you need to put something into place to level yourself out.
yes. And also, okay, to Dr. Weil, one last final question. I know a lot of people feel stuck. They're not sure where to begin to get
Yeah.
help for their depression. What advice would you give that person?
I think first of all, sort of validate and normalize your own feelings. You know, if a person's been through a difficult life experience, or life is stressful and difficult at the moment, and difficult dynamics in relationships, actually don't judge yourself. And actually, kind of, when I talk about validate and normalize, I kind of think, you know what? I've had a crappy time of it of late. It's no wonder I'm struggling. And I think that takes maybe the judgment and self criticism away. It's that, I'm not going mad. It's understandable I'm struggling and feel like this because I've been through some difficulties. Life is stressful at the moment. So I think that would be the first thing that would be important to do. Like we were just talking there, really good self care. And almost during a time of struggle, I would say go into ultra self care mode. You've got self care mode, which you should have even if you're well, but ultra self care mode. And see, maybe we were talking before about seeking perspective from with family and friends. Reach out to those people who are in the know and see, is there any social or community support out there that might help? It could be a group, maybe a walking group, a coffee group, somewhere where you can make connections, feel a bit more valued, have a bit of purpose, something to focus on. And then as well, if it's financially viable or there's access to it, see if you can get a recommendation, maybe if you feel it's right for you, to get some therapeutic support. Now, sometimes a recommendation can be helpful because I don't mind admitting in our profession, there's some average and poor therapy out there, you know? So it's
Mhm.
important someone maybe can land in the right space for them, you know? So essentially, it goes back to what we were saying before about making sure you get your needs met, because if your needs are not met, you'll struggle psychologically.
Yeah, no, yeah, absolutely. And of course, finding a good therapist, as you say. And yeah, well, definitely, Dr. Weil, I appreciate it, even though we just had a brief time, but you explained generally what it entails to go through a psychotherapy session and also shared some valuable advice. I really appreciate for you sharing today. And then hopefully maybe in the future we can have different, more specific videos on certain topics. Well, thank you so much.
Yeah, oh, my pleasure. And yeah, it's good to kind of have a conversation, come together and share some experiences and tips with your listeners. And hopefully some of it will be helpful. And yeah, and maybe we'll come back together for more kind of specific areas to have a conversation about.
Yeah, definitely. And I'll leave your information below.